Hi, I'm Dr. Frances Perrin. I am the Vice President of International Clinical Services here at BDA. Today I'm going to be talking about extinction, specifically ethics, function, and kindness in application. In a previous discussion on this topic, Dr. Pergar emphasized that extinction is a natural behavioral process. It is not inherently good or bad. Like any behavioral procedure, its ethical and effective use depends on how it's applied. Today we'll explore what makes the use of extinction appropriate or inappropriate in applied settings. One of the most critical first steps is identifying the function of behavior. Without understanding what's maintaining the behavior, be it attention, escape, tangibles, or automatic reinforcement, extinction is unlikely to succeed and may cause unintended harm. As Iwata and colleagues demonstrated, extinction is only effective when its form matches the function of the behavior. For example, if a child swears to gain attention, attention extinction by withholding your reaction is appropriate. But if a child tantrums to avoid cleaning up and you ignore the tantrum while still allowing escape, you're not using extinction, you're reinforcing the behavior. True escape extinction in that case would involve continuing the demand until completion despite the tantrum. These examples highlight the importance of matching the extinction procedure to the function. Failing to do so can lead to the ineffectiveness, extinction bursts, or more severe behaviors. It is also essential to remember that extinction involves withholding access to something meaningful to the individual. People should have access to reinforcement, and intervention should create new and adaptive ways for individuals to get their needs met. That's why extinction must be paired with teaching and reinforcement strategies. This can include non-contingent reinforcement, or NCR, where the reinforcer is provided independent of the problem behavior, or differential reinforcement, where alternative behaviors are taught and reinforced while the problem behavior is placed on extinction. The goal is not to just reduce problem behavior, but build skills that promote independence and dignity, such as communication, waiting, or task engagement. Also be aware that extinction can initially increase frustration or emotional responding. Monitoring and consistency and environmental supports are key, and in cases involving high-risk behaviors, extinction should be approached with significant caution, planning, and oversight. To guide ethical implementation, Tarbox and colleagues introduced the concept of kind extinction in behavior analysis and practice. They argue that extinction should be humane, trauma-informed, and centered on the dignity of the individual. This approach is not a separate technique, but a values-based framework that emphasizes teaching alternative behaviors before extinction is implemented, preparing individuals for what to expect during the process, minimizing emotional distress through compassionate, transparent implementation, and involving caregivers and clients in collaborative decision-making. Ultimately, extinction is not a tool for control, but one part of a comprehensive positive behavior support plan. Kind extinction reminds us how we implement our science matters as much as what we implement, and that compassion and effectiveness must go hand in hand. Thank you for watching. If you like this video, please like and follow for more.